So now I'm going to show you how to make sure your surgery suite is set up for surgery. Normally we have 2 patients going at the same time, so we're unsure who will go first. So before your patient is anesthetized and before you present, you just need to make sure you have the appropriate circuit sitting over here on the crash cart, right above the crash cart, ready for you to set up. After you've done your scrub and surgical prep, we'll then ask you to come in here and finish setting up surgery. You will then hook up your anesthetic machine to the appropriate circuit, and we will have another video on that, and pressure check it with your instructor. Then, just like we did in our prep station, we want to make sure our monitor equipment is kind of ready and waiting for us versus having it all coiled up, dangling here. So I'm going to, again, we have heavy pieces, so I like to kind of loop them on this little rail right here so they don't yank down. Just like that. And then I will attach it. Same with my EKG leads, just as we did before. Again, I'm going to rest this heavy part up here. And then I'm going to attach these just to the side over here. You don't have to worry about setting up the table, the surgical instruments, or the water blanket. Your instructors will take care of that ahead of time. So I have this monitoring equipment ready. I want to make sure the blood pressure tube is here ready as well for when I come in. If you need more blood pressure cuffs, they're in this drawer right here where it says NIBP cuff, so if you need any different ones, you can go in there. The last piece I want to make sure I have is my esophageal stethoscope. So you've got a couple sets of ears in here that you'll grab. And then there are a few different sizes, varying in diameter. So you want to pick the one appropriate for your patient. This guy's not teeny tiny, so I think that this kind of medium one will fit in him just fine. The 2 ears have different ends, so this one could go on these ears. This one fits these ears, so I'll grab this one. Grab myself a little paper towel to lay it on. And then we do want to make sure it's lubricated. It'll be easier to pass through the esophagus. We do prefer the use of sterile lube because you may accidentally end up in the trachea. So just to make sure we're not introducing anything, I opened it and I'm just gonna stick the end in it like that. So it can just sit like that so it's ready to go when I get here to place it quicker. And no, I lied, one more thing. Then the last piece of monitoring equipment is my capnograph. This is measuring end-tidal CO2. After I've pressure checked my machine, I want to go ahead and hook it to the end of my circuit. This way it can measure that carbon dioxide that's coming out. I can leave that hanging right there. Now surgery is ready.